So tell me, Hank, what is trauma?
The definition of trauma has expanded quite a bit in the last few years. We now understand it to be any experience that is hurtful or stressful, either physically or emotionally, and which exceeds our capacity to process it. And so that leaves us with a psychic wound or a soul injury, as Dr. Mike Hutchings calls it.
Okay. And so then what does it mean to be trauma informed?
As a caregiver, whether it's for pastoral care or medical care or an educator or a supervisor at the workplace, moving into a trauma-informed way of leading is by changing the question from what is wrong with you to what has happened to you. So it's to ask the question, why the pain?
Wow. So Hank, I've heard of trauma A and trauma B. What does that mean?
So trauma A, sometimes also called little t trauma, is when good things are not offered and given to a child or an adolescent or even an adult. Things like unconditional love, a secure attachment with a mom, a safe and present father, or a dry diaper. And trauma B, the big T trauma, is when hurtful things are done, such as frank abuse, whether it's physical abuse, sexual abuse, verbal abuse, or an experience such as coming upon a severe accident where there may be death or severely injured people. So the experience, it can be injury to oneself or witnessing it.
Got it. So there is a difference. It's important to understand the difference between both.
But it's important to realize that both leave significant psychic wounding.
Okay. Okay. So there's not the fact that one is less important than the other.
That's
okay.
correct.
It's very important. Good.
Yeah.
So how does trauma impact both the adult and adolescent?
So we now know unequivocally that unhealed or unprocessed trauma has significant impacts on adult health in all domains. So physically, it leads to increased risk for physical illness, particularly immune disorders, chronic pain. It also increases the risk for mental illness, such as anxiety and depression, and in childhood, the ADHD or autism.
Okay.
Relationally, we know that there's increased risk for relational struggles and conflict and parenting difficulties.
Okay.
And spiritually, we see that people will stagnate or even regress in their faith journey toward maturity.
Wow. So trauma has severe impact on us fully.
Yeah. And we now know a lot of the neuroscience behind that. Suppressed emotions, impaired neurodevelopment of the child.
Okay.
The brain wires more for vigilance. So people who have had trauma are more vigilant and more sensitive to the environment.
Okay.
And we even know that it affects chromosomes and causes significantly earlier aging and all the illnesses of aging.
Okay. So, Hank, based on all that you've shared in terms of the impact of trauma on the whole person, what do you hope conference attendees will gain from this weekend together?
Well, I hope that trauma survivors will take a huge stride in their healing journey and that they will leave the conference with a renewed hope that there are answers for them and that they can push through and have hope for thriving and flourishing. And for helping professionals, I hope that we will all learn strategies that are trauma-informed and techniques that will allow us to approach the people we care for with a trauma-informed approach.
That's great. And I know myself, I'm looking forward to learning this trauma-informed approach. I mean, it's going to be so important in what we do. And so beyond, for this conference, beyond those who have experienced trauma and those who are in a profession to help those who have experienced trauma, who else would this conference benefit?
Well, realistically, we're all on a journey, and I think we would admit that none of us have arrived. So I think we can all benefit and learn takeaways and have renewed hope.
Absolutely. And I think we could probably, all of us could list someone that we know that's experienced, whether it's small T trauma or large T trauma. And that could be, there could be things that we learn that could be of help to ourselves and others. So this is great. So Hank, tell me, is a faith-based approach to trauma valid?
Well, we know that spiritual disciplines such as forgiveness, solitude, rest, meditation are all have a good evidence base for being healing.
Okay.
And so, yes, a faith-based approach is valid. As well, we know that Jesus, in quoting his own mission statement from Isaiah 51, said that he was sent to come and to heal the brokenhearted.
And we know that trauma, that word actually means broken-hearted.
Right.
And so Jesus was referring to trauma even in his ministry on this earth.
Yeah.
So can a faith-based approach be harmful?
Any approach by any practitioner can potentially be harmful. So it's paramount that all of us in the helping professions have safety and use informed consent. And we just need to be sure that in our communities, people feel safe and there's accountability. And this is the reason why it's so important for helping professions to take a course or a conference like this so that we understand how important it is to keep safety.
That's so good. It is so important for us to recognize that we don't do this alone. We need each other. We need to learn and we need to grow in this area. So I'm excited about this conference.
We're wounded in community and we heal best in community. Yeah.
Which can seem like an oxymoron, but it's very true. We need each other.
Yeah.
That's so good.
Yeah.
So Hank, tell us how people can find out how to register and come to the conference.
Yeah, so we have a website, atlantictraumaconference.ca, and all the information is there, the schedule, the breakout sessions, and the hotels, the whole package is there on the website.
That's great. And so there is a keynote speaker, Dr. Mike Hutchings, and as well there's going to be breakout sessions. So there's a lot of opportunity to learn and go deeper into your understanding of trauma at this conference in September. And so I just want to encourage all of you to head to atlantictraumaconference.ca, check it out, register. We look forward to seeing you in September.